Hi there, Dr. Paul here from Absolute Dental Care. Today we're going to talk a bit about implant processes and what someone goes through if they've lost a tooth. And one of the options they have when they lose a tooth is in fact going down that implant process. An implant is a titanium screw that gets put into the jawbone and the bone is then allowed to heal around the end of it. So when we decide to go down this process, the first thing we do is we send the patient off for a specialist and they actually put the implant into the jawbone, okay? And they tap a little tiny hole in the bone. It's all done under just local anesthetic, doesn't need to be done under general anesthetic or anything like that. And most people report it's actually easier than having a tooth taken out. So what they do is they tap this little tiny hole, they put this little tiny titanium implant that's in there, and they allow that bone to grow around that implant for over about 12-week period. Once that bone, the implant is actually in there and it's solid, and it's what we call osseo-integrated, basically it's stable, then the specialist sends the patient back to us, and then we take a very accurate scan using this little camera and the little intraoral scanner, and we then get this mold of the tooth and an impression of it, if you like to look at it that way, and we send it away to the laboratory to be made. The laboratory then sends the finished product back, and this is what one actually looks like, and I'll bring that up to the camera at least anyway, and that's the implant bridge in this case, where it's actually one implant, and this is where the implant itself goes down into the jawbone, and we've actually got two teeth that it's replacing in this particular case. And if you have a look deep down inside there, you'll see this little tiny silver bit in there. That's simulating what the implant would look like deep down into the jawbone. And then what we do is we take this little implant, and this has got a little screw in it. We actually pop it on the top of the tooth, just like that. And through the little hole that's in the top of it, where we can actually put a screwdriver down there and actually tighten that screw up, and it stays in the patient's mouth. And we close that little hole up with a little bit of a filling material just to seal it up. And that's what an implant or an implant bridge is all about, and to replace one or more missing teeth. Once again, I'm Dr. Paul from Absolute Dental Care. If we can ever help you with replacing teeth, such as implants, then give us a call on 3870 1300. Nice to talk to you. See you next time. Bye-bye.